Hello, my name is Hugo and this is my video assessment number 1. We will start off with the skin, the upper extremities. We're looking at the skin, light tan pigmentation, smooth texture. Okay, I don't see any lesions, nothing there, a little bit of moles. Okay, if we look at the lower extremities, we also see it's light tan pigmentation, smooth. Do you shave your legs?
Yes, I do.
No folliculitis, a little bit of moles though. A couple scars right there, scarring right here, no varicosities and no edema is present. Okay, we'll go back to the hands and we're also looking for turgor, any tenting, no tenting, well hydrated. Here and just the feet too, just check for any tenting, relax, no tenting, okay, no tenting. We're also looking at the nails, short and well trimmed, okay. Checking for capillary refill. It's less than 3 seconds. We're also going to do the feet. We'll check the toes. Toes are a bit cool, but that's normal. Okay, we'll do that with that way too. Okay, the hair, we'll distribute. Okay, good. I don't see any lesions. Good. Okay, so now we will look at the head. Okay, the head is symmetrical. Okay, just look at the scalp. Does that hurt?
No.
No tenderness, nothing. Scalp, there's no lesions, clean, the hair is smooth, okay, light blonde, okay. We also look at the TMJ, transmandibular joint right here, crepitus, okay, we're clicking, it's okay. Alright, so now we're also checking for cranial nerve number 5, trigeminal. Do a little test. If you could close your eyes and tell me if it's either smooth or sharp.
Smooth. Sharp. Smooth. Smooth. Sharp.
Okay, that's good, within normal limits. We're also going to check for our cranial nerve number 3, which is for facial movements. So we're going to ask you to smile, frown, puff out your cheeks, purse your lips. Okay, very good. Okay, so now we are moving on to the eyes. This is cranial nerve number 2, optic nerve. We're going to check, we did the Snelling test for distant vision, which is she'll stand 20 feet away from a board and she'll read lines that will get shorter. And if she could read line number 20 in 20 feet, then she has 20/20 vision. And the Rosenbaum test also tests for short distance, and instead she'll hold a card 14 inches away from her and she'll read the lines too, with each eye covered and then without covering any eyes. It's also a test for cranial nerve number 2, confrontation. If you don't mind just putting your hand on one eye, and this is a peripheral vision. So you're going to tell me when you see the pen, okay? Just look at me. There we go.
See it. See it.
Okay. Keep your hand on that eye. The same here.
See it. See it. See it.
Okay. That's good. Okay. So now we're going to be testing for extraocular movements, muscle movements. And that is cranial nerve number 3, 3, 4, and 6, abducens, trochlear, and oculomotor. For that, it's the 6 cardinals of gaze. You're going to look at this pen. You're going to follow it. It's checking for muscle movements, extraocular muscle movements. Very good. And we're going to start again. Look at the pen. Follow it. Okay. Good. Very good. We would also do a cover to uncover test. So you're going to place one hand in one eye, and you're going to look at an object there. But now move your eye to your left and stay to the left. The eye, move it to the left, and now uncover this eye. There you go. Okay, good. We're also looking for corneal reflex, and you can see the reflection on the same spot in both eyes. Okay, good. Alright. Okay, so now we will be inspecting the eyebrows. symmetrical and extend past the outer canthus of the eye. It's well trimmed. The eyelashes are curled upwards. Okay. Lacrimal sac. Do you feel any tenderness, any pain when I press there?
No.
No. We're also going to look at the conjunctiva. It's pink. The sclera is white. A little bit of veins in there. Position of glow. Okay. All right. So now we would. Then this is an ophthalmoscope, and I will be looking for the. Okay, we are looking for the red reflex, the optic disc, so yellowish color. We will be looking for any lesions there, non-present, normal. The optic disc is like a oval shaped, almost looking like a frisbee, and any retinal vessels, central ovalis. Okay. Now we will be moving on to inspection into the ears. Okay. Looking at the ears, the helix coils back, and it's in alignment to the outer canthus of the eye. No lesions are present. It's clean. Okay. We would do this to both both ears. I'm going to pretend this is an otoscope. We'll be looking through like this by holding the pinna up. We're looking at the external canal. There's a bit of hair, mild cerumen, and we will also be looking for the if there's any discharge. We will be looking at the tympanic membrane, the malleus, the umba, the pars flaccida, and the tense. Okay. From the ears, looking at the nose. Do you feel any pain when I do that? The nose is symmetrical and midline compared to the head. Over here, turbinates. Lift up a little bit. No discharge. No lesions. Okay. We would test olfactory, which is cranial nerve number 1. Before we do that, if you don't mind just scanning the room, can you come this way and just scan the room, please? Scan the room. There you go. Keep scanning. Scan the room.
Go all the way around.
All the way around. Go all the way around. Scan the room. Okay. Alright, thank you. Alright, so we're back to olfactory cranial nerve number 1. We would just do a couple tests for that. If you don't mind just holding one nostril and you close your eyes. Tell me what this is.
Peppermint.
It's peppermint. Okay. Now with the other nostril, close it. You're going to tell me what this is?
Lavender.
Lavender. Okay. And also just checking for patency. If you close one nostril, tell me, breathe in, and to do the same with the other one. Okay. Alright. Alright. We would also do a whisper test. This is a cranial nerve number 8, acoustic. So you're going to put one hand on your ear, and I'm going to whisper. You're going to tell me what I'm saying.
The weather is hot.
Okay. And there's also a Weber test. We use the tuning fork. I'm going to put this above your head, and you're going to tell me if you could hear on your left or your right ear or both.
Both.
Okay. Now we're also going to do the Rhine test. Okay. This one I'm going to put it behind the mastoid process, and you're going to tell me when you hear it, when it stops. Okay.
Okay.
Now I'm going to hold it here. You're going to tell me, can you hear it?
Yes.
Let me know when it stops.
Stops.
Okay, so air conduction to bone conduction should be the 2-to-1 ratio. Okay, so that was testing for the ears. Okay, we did we did the nose, and now we look at the mouth. Let's see. Let's look at your mouth. We do inspection of the mouth. The mouth is symmetrical. The teeth. I'm gonna put my gloves on. Look at the gums. Inspect everything. No lesions are present. Yeah. Okay, here, stick your tongue out. We're going to look at the uvula. It's present. Tonsils are +2. If you lift up your tongue, the frenulum is there, the Wharton's duct, and the, I forget the name of it. Stenson's duct is right here. Okay. The teeth, let's see, look at your teeth. Good, very good. This is a cranial nerve. Hypoglossal cranial nerve number 12, I believe it's cranial nerve number 12, and cranial nerve number 9 will be the and the hypoglossal tongue movement. Can you move your tongue? Okay. And the and I see the gag reflex. There we go. Gag reflex. Okay, good, very good. All right. So now we will look at the neck. Inspecting the neck is midline, the trachea, copy the trachea. Okay, any tenderness there?
No.
No? Okay. There's also nodes here, anterior nodes, deep nodes, posterior nodes, post-auricle nodes, anterior nodes, and submandibular and sublingual nodes. Sternocleidomastoid nodes over here. We will be palpating for the carotid, it's present here. No JVD, no distension. We would also be auscultating for the carotid. This is no bruise are present. We would do it from the bell of the stethoscope. No bruise present. The carotid. We will be also cranial nerve number 12. If you don't mind just pushing against the shoulder, okay? And you're going to push one side. You can do it here. Okay, so we will be doing that. And we also check for the thyroid. If you don't mind just standing up, I can't get behind you. So we would just, the thyroid will be right here. If you don't mind just tilting your head to your left, right here. And if you mind moving your over here, right here. And we would also auscultate, you could say, the thyroid with the stethoscope. Thank you very much.
You're welcome. Awesome.